Hello, today my group and I will be talking about the medication Digoxin, and hopefully by the time you're done watching it, you'll understand what the medication is, its indications, side effects, what the nurse should teach the patient, some legal health policies, and at the end of the presentation, you will also be given some NCLEX style questions about our presentation. So, Jennifer will actually talk about the knowledge and understanding of this medication. Things like the brand name, the classification, how the drug works, the therapeutic use, and the dose. I, Ariana, will be talking about the application of the medication, how it works in the body, how we get rid of the medication, and how our genes can play a role in it. Ellen will be discussing the physiological, developmental, psychological, socioeconomical, cultural, and spiritual responses to the drug. Jen will discuss the drug evaluation, some health inequities based on age and gender, race, and ethnicity. She will also discuss Category 7, again applying medication, discussing the scope of practice, drug standards, and legal regulations. And Tao will discuss Category 6, applying the drug in methods and monitoring the effectiveness of the pharmacotherapy.
Hi everyone, my name is Jennifer, and today I will be giving you guys a little bit of knowledge and understanding about our drug Digoxin. So the brand name is Digoxin and the generic name is Digoxin. The drug classification is a cardiac glycoside and inotropic agent, and drug pregnancy category. As of now, it's unknown if the drug can affect the fetus during pregnancy. Therefore, it should be used during pregnancy only if clearly needed and when it's cleared by a medical provider. And if digoxin needs to be given during pregnancy, we must monitor neonate signs for symptoms of digoxin toxicity. Specifically, the most important is cardiac arrhythmias. Let's see. Next, we're going to talk a little bit about understanding. So, the mechanism of action of digoxin, essentially it promotes calcium movement from extracellular to intracellular cytoplasm to aid in myocardial contraction by inhibiting the sodium-potassium ATPase pump. So essentially, by causing an influx of calcium, it allows our myocardial muscle to contract more easily and more effectively. And then our therapeutic dose is going to be 0.8 to 2.0 nanograms per milliliter. And then the route can be given by mouth or intravenously. In addition, for frequency, it's given every 6 to 8 hours, usually for loading doses, and then for maintenance doses, we're going to give every 12 hours or once daily, with once daily being the most common. And then duration of treatment is long-term. In the majority of cases, it's going to be a lifelong treatment.
Hello, my name is Ariana, and we're going to apply what we know about digoxin. We're going to apply the pharmacodynamics, the pharmacokinetics, and the pharmacogenomics. Pharmacodynamics is the effect of drugs and the mechanism of action. Digoxin will bind to the sodium-potassium ATPase in the myocardium. The sodium-potassium ATPase maintains a higher concentration of sodium extracellularly and has a high level of potassium intracellularly. By inhibiting the sodium-potassium ATPase, it increases the intracellular calcium to bind to the heart cells, increasing the contractility of the heart. Pharmacokinetics is the movement of drugs within the body. About 70 to 80% of digoxin is absorbed in the small intestines. The absorbed drug will be distributed to the heart and kidneys in large amounts. It will also be stored in the skeletal muscles in the largest form of digoxin storage. The main route of excretion of digoxin is through the kidneys via glomerular filtration. Impaired kidney function can have the greatest influence on clearing digoxin, which can impact the serum level of digoxin, leading to dig toxicity. Pharmacogenomics, also known as pharmacogenetics, looks at how your DNA affects the way you respond to drugs. Digoxin is a cardiac glycoside that enacts its effects on the heart cells. Studies show that African Americans have a higher mortality rate compared to Hispanic and whites. Digoxin will normally shorten the QT interval. However, in patients with the NOS1AP gene variant have been known to have an increased and prolonged QT interval. Digoxin has also been known to increase the rate of death in women from any cause than of men.
My name is Ellen, and I'm going to analyze the physiological, developmental, psychological, socioeconomical, cultural, and spiritual responses to digoxin. The physiological impact of digoxin is increasing cardiac output, slowing heart rate, and improving blood flow. With all the good qualities it also has a risk for potential electrolyte imbalances and toxicity at high doses. On development, a study analyzed data from 16 studies that investigated the use of digoxin during pregnancy and its impact on various developmental outcomes, including cognitive development, behavioral problems, and neurodevelopmental disorders. The study found that prenatal exposure to digoxin was associated with an increased risk of neurodevelopmental disorders, including ADHD and autism spectrum disorder. However, there was no significant association between digoxin use and cognitive development or behavioral problems. Socioeconomically, the cost of a 30-day supply of digoxin can range from around $4 to $50, depending on whether you use a discount program, have insurance, or pay out of pocket. Overall, while the cost of digoxin can vary, it is generally considered to be an affordable medication for most patients who need it. The cultural and spiritual responses are: there is limited information on specific cultural and spiritual views on digoxin. However, some cultural and spiritual traditions view the heart as the center of emotions and the soul. In these traditions, medications or treatments that affect the heart may be viewed symbolically or metaphysically. For example, in traditional Chinese medicine, the heart is considered the emperor of the body, and imbalances in the heart can lead to imbalances in the emotions and spirit.
Hi, this is Jenny. I'm gonna do the evaluation on digoxin. So when it comes to gender and age, older adult and male are higher risk for congestive heart failure. Therefore, they are more prone to use the medication digoxin. When it comes to racial or ethnic, African American are at higher risk to have heart failure comparing with Hispanic, Caucasian, Asian, and other race. Caucasian in specific is European are more prone to have AFib comparing with other race. So digoxin more indicate like we use it a lot more when the patient have heart failure or AFib. Whoever or whatever gender that have more prone to heart failure and AFib will have more prone to use digoxin.
Hello, I'm Tao. Now I'm going to take over the number 6, which is the application monitoring the effectiveness of pharmacotherapy in relation to the laboratory, radiology, informatics to deliver the safe and quality health care. So to monitor it, we should monitoring the potassium level, the normal range from 3.5 to 5 milliequivalent per liter. If any hypokalemia, the lower potassium, it would increase the effect of digoxin and can result in digoxin toxicity. Also, beside potassium, we should monitoring the serum of digoxin. So make sure it is in the normal therapeutic range would be from 3.8 to 2 nanogram per milliliter by withdrawing the blood at least 6 to 8 hours after the last dose or before the next scheduled dose. If increasing the, it could cause toxicity if they're increasing of serum digoxin. Besides that, we can monitor EKG if see any abnormal, such as prolonged PR interval or depress the ST segment. We should also educate patients to report if there are any pulse change, rhythm change, and also monitoring patient blood pressure. And might give patient handout to give to the patient. Yeah, and that is my part.
Hi, this is Jenny again. I will talk a little bit about application of digoxin. I will focus more in medication administration and patient education. So for medication administration, every nurse must perform 3 checks, including 5 rights in it. The first check will be checking with the MAR, checking before you pull the medication from the pixie. The second check will be before you enter the patient room. And the third check, it will be at the bedside before you administer the medication. Each check must including 5 rights: right patient, right drug, right dose, right route, and right time. The last check at the bedside, we must perform right documentation also. So doctors, pharmacists, nurses are responsible to understand why is a drug being prescribed. In this case, it will be most likely the patient will have AFib or heart failure, and how much of the drug is appropriate for administration. Digoxin have very small therapeutic range. It is 0.8 to 1.5 only. Therefore, the doses of the drug must be appropriate. We have to be very careful with the doses. If not, we can cause toxicity. We should educate the patient about the side effect of the medication, such as hypopotassium, low potassium, low magnesium, and high calcium. We also should educate the patient that do not stop abruptly. Caution with on-top counter medication or herbal supplement, especially the St. John wort. We should teach the patient to maintain low sodium diet and encourage them to increase potassium intake. They can do like supplement, or they can eat food that contain high potassium, such as banana, potato, raisin, dark leaf vegetable, or even the substitute salt actually good for the patient because it contains a lot potassium instead of sodium. Teach the patient to report if they have shortness of breath, weight gain, edema, persistent cough, because this may be the sign of the heart failure issue. Teach the patient to take the medication at the same time every day to provide the best effect of the medication. If the patient forgot to take the medication, they can take it if it is more 12 hours or more than 12 hours before the next dose. But if it's less than 12 hours before the next dose, the patient shouldn't take the medication because it's going to increase the doses of the medication, the digoxin, and may cause toxicity. Teach the patient to take the radio pulse before taking the medication, and also teach them to monitor their blood pressure that will have with the disease itself. We also have Kabuk and Clark style question. It's on our PowerPoint and it is multiple choice question. I will just read the question for you. Such as question number 1, digoxin is part of what family of drugs? Question number 2, an adult patient is being discharged home on digoxin. Which statement below verbalized by the patient demonstrate they understand how to properly take this medication? Question number 3, which of the following accurate describe the mechanism of action of digoxin? Question number 4, a patient is taking digoxin for heart failure. Which of the following lab values should be monitored closely while the patient taking this medication? And question number 5 is, a patient is prescribed digoxin for heart failure. Which of the following instructions should the nurse provide to the patient to promote medication effectiveness? All of the answer is on our PowerPoint. Please feel free to take a look and try to do it yourself to have the better understanding of the medication. And that's gonna be all for us. Thank you.